You look in the mirror and trace the line with your fingertip. Maybe it's an old surgical scar on your knee that feels tight when it rains, or perhaps it's a deep furrow on your forehead that seems to have cemented itself there over the last decade. You wonder why that patch of skin looks so different from the rest. It's shiny, perhaps a bit raised, and it lacks that soft, flexible texture of the skin right next to it. You've been told that's just what healed looks like. You've been told to accept it as a badge of honor or a sign of aging. But what if I told you that what you are looking at isn't actually the finished product? What if I told you that a scar is simply what happens when your body panics and rushes the job? There is a biological reason why that skin never looks the same, and it has nothing to do with your age or your genetics and everything to do with geometry. When you understand the insider truth of how your skin rebuilds itself, you realize that you have more control over the final appearance of that scar or that deep wrinkle than you ever imagined. Today, we are going to dive deep into the scar paradox. We're going to uncover why your body chooses speed over quality, and more importantly, how we can gently convince it to go back and finish the job properly. We're going to talk about the hidden mechanism of panic collagen and the simple manual technique backed by hard science that can help remodel that tissue back into the healthy, strong skin. You remember, before we unlock these secrets, if you appreciate deep dives into human health that prioritize science over trends, consider subscribing to our community. We share the kind of senior health tips that doctors often overlook in the rush of a 15-minute appointment. I'm curious, where in the world are you watching from today? Let me know in the comments below. It's always wonderful to see how far our community reaches. Now, let's get into the first crucial concept, which helps us understand why the scar exists in the first place. This is what I call the panic response. To understand how to fix a scar, you have to understand the chaotic environment in which it was born. When you cut yourself or when you undergo surgery, your body treats it as a 5-alarm fire. Its number one priority is survival. It needs to close the breach to prevent infection and stop bleeding. It doesn't care what it looks like. It cares that you stay alive. In this frenzy, your body deploys special cells called fibroblasts to lay down collagen. But because speed is of the essence, these cells lay the collagen down in a single unidirectional alignment. Think of it like a stack of lumber thrown hastily across a ditch to make a bridge. It's functional, it gets you across, but it's rigid and unsightly. A study published in the Journal of Investigative Dermatology found that in normal, uninjured skin, collagen is aligned in a complex basket weave pattern. This cross-hatching is what gives your skin its elasticity and strength in all directions. Scar tissue, however, is comprised of collagen fibers aligned parallel to the skin surface. That parallel alignment is why the scar feels stiff and looks shiny. It's strong in one direction, but weak in others, and it lacks the structural complexity of healthy skin. The paradox is that your body healed you, but in doing so, it created a material that is structurally inferior to what was there before. So, how do we move from a panic repair to a quality restoration? This brings us to the next phase of our journey, the remodeling window. Many people believe that once a scar has formed and the scab falls off, the healing process is done. That is a myth. The visible closure of the wound is just the beginning. The maturation phase or remodeling phase can last anywhere from 1 to 2 years. This is the window where we can make a difference. During this time, the body is constantly breaking down old collagen and laying down new collagen. It's a dynamic process. However, left to its own devices, the body usually settles for good enough. According to research in the journal Advanced Wound Care, even a fully matured scar only regains about 80% of the tensile strength of normal skin. But here is the empowering part. We can influence this remodeling. We can signal the body that the emergency is over and that it's time to stop piling up lumber and start weaving a basket. This leads us directly to our primary solution, something that sounds almost too simple to be true, but is supported by fascinating mechanobiology, mechanical stress, or as you might know it, massage. We aren't talking about a relaxing spa rub down here. We are talking about targeted, specific manipulation of the tissue. When you massage a healing scar or a deep wrinkle, you are applying mechanical force to those fibroblasts we talked about earlier. You see, cells are sensitive to touch and pressure. This phenomenon is called mechanotransduction. When you apply pressure and friction to the scar tissue, you are physically disrupting those parallel panic-stricken fibers. A pivotal study published in PLOS One demonstrated that mechanical stress, specifically massage, can reduce scar height and redness by regulating the expression of TGF beta 1, a protein that controls scarring. Essentially, by massaging the area, you are sending a signal to the cells to break down the rigid parallel collagen and replace it with a more disorganized, flexible basket weave pattern. You are manually telling your body, it's safe now. You can take your time and build this, right? But before you start rubbing away, we need to talk about technique because there is a right way and a wrong way to do this. This brings us to the cross friction method. If the problem is parallel fibers, we cannot simply rub in the same direction as a scar, or we might reinforce that alignment. We need to go against the grain. Imagine you have a ball of tangled dough that you want to flatten out. You wouldn't just pet it, you would knead it. The technique involves using your thumb or fingertips to apply firm pressure perpendicular to the direction of the scar or wrinkle. If the scar runs up and down, you massage side to side. A study in the Archives of Physical Medicine and Rehabilitation analyzed the effects of friction massage on soft tissue and found that it significantly improved the alignment of collagen fibers, making the tissue more pliable and functional. The goal here is to physically separate those stuck fibers. It might feel a little tender, and that is okay. You are literally breaking micro adhesions. You want to do this for a few minutes, 2 to 3 times a day. It's a commitment, but it's the mechanical input your skin needs to understand. It needs to remodel. Now, while we are talking about manipulation, we have to address a very common question. Does this apply to wrinkles? The answer is a resounding yes. This is what I call the deep wrinkle connection. We tend to think of scars and wrinkles as two different things, one from an injury, one from aging. But structurally, a deep static wrinkle, the kind that is there even when your face is resting, has a lot in common with a scar. In deep wrinkles, the collagen has collapsed and often reformed in that same stiff parallel manner at the bottom of the crease. It is essentially a microscar caused by repetitive motion and structural breakdown. Research in the Journal of Anatomy has shown that the dermis beneath a deep wrinkle exhibits histological changes very similar to scar tissue, including a reduction in the normal basket weave organization. Therefore, the same principles apply. By massaging a deep wrinkle using that cross friction technique, you stimulate blood flow and encourage the fibroblasts to wake up and reweave the collagen floor of that wrinkle. You aren't just ironing it out, you are rebuilding the foundation. If you are finding this breakdown of skin biology helpful and you're starting to look at your skin a little differently, please take a second to hit that like button. It helps us get this information to more people who are looking for real solutions. Let's move on to an environmental factor that is absolutely critical for this process to work. You can massage all day, but if you ignore this next point, you might be fighting a losing battle. We need to talk about hydration and occlusion. You might have heard of silicone gel sheets for scars. They are the gold standard in medical scar management, but few people explain why. It's not just about covering the wound, it's about water. The stratum corneum, the outer layer of your skin, acts as a barrier to keep water in. In a scar, this barrier is compromised, leading to high levels of water loss. This dehydration puts the fibroblasts back into panic mode. They think, oh no, we are drying out. Work faster, lay down more rigid collagen. By applying a silicone sheet or a thick occlusive moisturizer, you restore that hydration barrier. A comprehensive review in the Cochrane database of systematic reviews confirmed that silicone gel sheeting is effective in preventing abnormal scarring, largely because it normalizes the hydration levels of the scar tissue. This hydration tells the fibroblasts to calm down. It reduces the production of excess collagen and allows the remodeling enzymes to work effectively. So after your massage, seal the deal. Use a silicone patch or a heavy, safe ointment to lock in that moisture. Now, let's look inward. We cannot build a new basket weave pattern if we don't have the weaving material. This brings us to the nutritional blueprint. You can have the best construction crew in the world, which is your massage and your hydration. But if you don't deliver lumber and bricks to the job site, nothing gets built. The two most critical components for collagen synthesis are vitamin C and zinc. Vitamin C is a cofactor for the enzymes that stabilize the collagen molecule. Without it, the collagen produced is weak and unstable. Zinc is essential for DNA synthesis and cell division. A study in the Orthopedic Journal of Sports Medicine highlighted that vitamin C supplementation significantly accelerates collagen synthesis and soft tissue healing. As we age, our ability to absorb nutrients decreases. So we need to be intentional about this. Are you getting enough citrus, peppers, or strawberries? Are you considering a quality supplement? Imagine trying to knit a sweater but running out of yarn halfway through. That is what happens to your skin remodeling without these nutrients. It stalls. Ensure your diet is rich in these building blocks to support the work you are doing on the outside. There is another external enemy that we must defend against, and it is deceptive because it feels so good. I'm talking about the solar cement. We all know sun damage is bad for skin, but it is catastrophic for scars and healing tissue. Fresh scar tissue has fewer melanocytes, the cells that protect us from UV radiation. This makes it incredibly susceptible to burning. But beyond the burn, UV radiation triggers inflammation. Remember, inflammation is the fire alarm that causes the panic response. If you expose a healing scar or a deep wrinkle to UV rays, you are re-triggering that alarm. The body responds by cementing the collagen fibers together to protect itself, often leading to hyperpigmentation, turning the scar dark brown or red, and hardening the texture. A study published in Photodermatology, Photoimmunology, and Photomedicine demonstrated that UV exposure significantly delays wound healing and increases the severity of scar appearance. The takeaway is non-negotiable. If you are remodeling a scar or treating wrinkles, that area must be protected with high SPF or physically covered. Do not let the sun undo your hard work. Let's shift gears to the tools of the trade. While your fingers are excellent, sometimes we need a little leverage. This introduces the assisted mobilization concept. This is where tools like gua sha stones or facial rollers come into play, but again, we must use them with a scientific mindset, not just a beauty trend mindset. The goal of using a tool is to create controlled shear stress in the tissue. A flat tool, like a gua sha stone, allows you to scrape along the skin surface, which pulls the layers of the skin relative to the muscle underneath. This sliding motion helps break up adhesions between the skin and the underlying fascia. When a scar feels stuck or tethered to the bone or muscle, it's because those adhesions have formed deep down. Research in the Journal of Bodywork and Movement Therapies has shown that instrument-assisted soft tissue mobilization can improve range of motion and alter microvascular blood flow. If you have a surgical scar on a joint, like a knee replacement that feels tight, using a tool to gently scrape around the scar, never directly on an open wound, of course, can improve mobility significantly. It's like using a pry bar to gently loosen a stuck window. Now, we have to talk about the timeline because this is where most people fail. I call this the persistence curve. We live in a world of instant gratification. We want a pill that fixes the pain in 20 minutes. But collagen remodeling is a slow biological process. It operates on a timeline of months, not days. When you start massaging a scar or a wrinkle, you might not see a visible difference for 4 to 6 weeks. That is the time it takes for a full cycle of skin cell turnover. If you stop after 2 weeks because it's not working, you are quitting right before the breakthrough. A long-term study on scar management published in the International Journal of Nursing Studies emphasizes that consistency over months is the primary predictor of a good cosmetic outcome. You have to view this as a daily hygiene habit, like brushing your teeth. You wouldn't brush your teeth once and expect them to stay clean for a year. Similarly, you cannot massage a scar once and expect the collagen to realign. It is the cumulative effect of daily signaling that changes the tissue structure. Next, let's discuss the role of blood flow, specifically localized circulation. We touched on this with massage, but we can enhance it. This is the oxygen infusion. Blood brings oxygen and nutrients to the site and carries away waste products. Scar tissue often has poor vascularization, meaning it doesn't have a great blood supply compared to healthy skin. This is why old scars sometimes look white or pale. They are literally starved of blood. By applying heat, gentle, moist heat before you massage, you can dilate the blood vessels and flood the area with resources. This prepares the tissue, making it more pliable and receptive to the mechanical remodeling. It's the difference between trying to mold cold clay versus warm clay. Conversely, contrast therapy, alternating warm and cool, can create a pumping mechanism. A study in the Journal of Athletic Training supports the use of heat to increase tissue extensibility. So try applying a warm compress for 5 minutes before you do your cross-friction massage. It primes the biological pump. We must also address the chemical environment of your body, specifically stress. This is the cortisol blockade. It sounds abstract, but your emotional state has a direct impact on your skin's ability to heal. Cortisol is the body's primary stress hormone. When cortisol levels are chemically high, it inhibits the production of collagen. It puts the body in a catabolic state, meaning it breaks down tissues rather than building them. If you are constantly stressed, your body diverts resources away from non-essential tasks like skin remodeling and toward essential tasks like keeping your blood pressure up for a fight or flight response. A study in the Journal of Immunology found that psychological stress delays wound healing by significantly impairing the immune response and collagen deposition. So managing your stress, whether through deep breathing, walking, or just sitting quietly, is actually a skincare strategy. You are lowering the barriers that prevent your body from fixing that scar. Now, let's talk about the nighttime. This is the nocturnal repair shop. Your body does the vast majority of its healing and regenerating while you are asleep. This is regulated by your circadian rhythm. During deep sleep, your body releases growth hormones that are essential for tissue repair. If you are cutting your sleep short, or if your sleep quality is poor, you are robbing your construction crew of their shift. This is when the basket weaving actually happens. Research in Nature Cell Biology has elucidated how the circadian clock controls the production of collagen fibrils. Disrupted sleep leads to thinner, weaker collagen fibers. So prioritize your sleep. It is not just rest, it is active therapy for your skin. If you are struggling with a stubborn scar, ask yourself, am I giving my body the 8 hours it needs to work on it? Finally, I want to touch on a concept I call the acceptance paradox. This might sound contrary to everything we've just discussed, but it is vital for your mental well-being. While we strive to improve the appearance and function of our scars, we must also acknowledge the story they tell. A scar is a survivor's mark. It means you went through something, a surgery, an accident, a trauma, and you are still here. There is a psychological component to healing. If you look at your scar with hatred or disgust, you are creating a negative feedback loop of stress. If you can, shift your mindset to view the scar as a project, something you are working with rather than fighting against. You change the dynamic. A study in the Journal of Behavioral Medicine suggests that positive emotional states are linked to better health outcomes and faster recovery. Treat your scar with care, not aggression. You are coaching your skin back to health, not punishing it for being damaged. So let's bring this all together into a clear, actionable summary. We've covered a lot of ground, but the protocol is actually quite simple. First, understand that your scar is panic collagen, laid down in parallel lines. Your goal is to remodel it into a basket weave. Second, use mechanical massage, specifically cross friction, moving against the grain to break up those fibers. Third, keep the area hydrated and occluded with silicone or thick moisturizers to stop the panic signal. Fourth, feed your body the vitamin C and zinc it needs to build new collagen. Fifth, protect that remodeling tissue from the sun at all costs. And finally, be consistent, patient, and kind to yourself. This is a marathon, not a sprint. You have the power to change the architecture of your skin. It is not magic, it is biology. By applying these principles, you are partnering with your body's innate intelligence to finish the job it started in a hurry. You are telling your skin, it's okay. We're safe now. Let's build something strong. I hope this deep dive has given you a new perspective on those lines and marks that we all carry. It's empowering to know that we aren't stuck with the first draft of healing. We can edit the story. If you found value in this, if you learned something new about the amazing machinery of your own body, please leave a comment below. I'd love to hear, do you have a specific scar or area you're planning to treat with these techniques? Share your story, your experience, might encourage someone else who is struggling. And please, if you haven't already, click that like button and subscribe to the channel. We are building a community here that believes in proactive, science backed health because your health and your confidence is worth fighting for. Until next time, keep moving, keep learning, and remember, your body is capable of incredible things if you just give it the right instructions. Take care.